We are now going to hear from about unique needs and a unique opportunity to work with within the Indian Health Service. Captain Celissa Stevens is here. She has 25 years as civil service and a United States Public Health Service nurse officer in the Indian Health Service. And she served in very many capacities within the Indian Health Service. She has provided clinical management and administrative nursing services for tribal and federal facilities while serving in the Indian Health Service local area and headquarters levels. Please welcome her to speak to us.
Thank you very much. It's a pleasure to be here, and I thank you very much for the invitation to address your meeting. It's a very important meeting about breastfeeding, and it's a priority in Indian Health Service. First, I'd like to expand my introduction and just say that I'm a member of the Choctaw Nation. When I typically introduce myself, because my name is hard to pronounce and hard to remember, I tend to tell people, see Lisa, there she goes. And hopefully you will all be going with me shortly when we leave the building. But it's been a great day, and I hear that the conference has gone well, so thank you. Do I click the red button? The white, this one. Oh, there we go. Thank you. I'll start with a brief introduction of our agency. For those of you who are not familiar with our system, we provide health care services for approximately 2.2 million Native Americans and Alaska Natives across the country. We do this to approximately 566 federally recognized tribes. Our fiscal budget for 2015 was $4.6 billion. Indian Health Service consists of approximately 15,370 staff, of which we have 2,480 nurses, which I oversee that program, 750 physicians, 700 pharmacists, 670 engineers and sanitarians, 280 dentists, and 200 physician's assistants and nurse practitioners. We have approximately, of those people who work for us, 69% are American Indian or Alaska Native. The health disparities that we face in Indian country, yes, that's true, are varied, and they are broad. We experience very high rates of health disparities in addition to the challenges that we face primarily in rural locations. The Indian healthcare system focuses on a number of other challenges too that are driven by the host of medical and cultural and socioeconomical factors that include population growth, which causes an increase in the demand for our services, medical inflation, and a budget that doesn't keep up with that, the rising cost of delivering services, especially in rural areas, and difficulty recruiting and retaining medical providers and nurses, especially in our remote areas. Additional health disparities include increased rates of chronic diseases such as diabetes and cancer, which are more complicated to address. Out-of-date facilities, I know this sounds sad, but out-of-date facilities and equipment, lack of sufficient resources to meet demands for services, and then balancing the needs of our patients served in our diverse network, which includes tribal, urban, and rural and Indian health service programs. So we are like a four-pronged system. Our Indian healthcare system looks like this. We have healthcare facilities ranging from hospitals and clinics that serve a variety of populations in rural and urban areas. So out of those 28 IHS hospitals, 13 of our hospitals are baby-friendly designated, and those are hospitals that only provide obstetrical services. We also provide 33 urban-centered organizations which provide healthcare services at 57 different sites across the nation. What are our priorities? Basically, we have four. And those priorities are, first, to renew and strengthen our partnership with tribes and the urban Indian health programs. Our second is to reform the Indian Health Service. Our third is to improve the quality of and access to care, which nursing is critical in that component. And then fourth is to ensure that our work is transparent, accountable, fair, and inclusive. So IHS is leading the way with the Baby Friendly Hospital Initiative, and I say this because all 13 of our OB obstetrical hospitals are baby friendly designated. Across the nation, according to Baby Friendly USA, only 10% of the hospitals in this country are designated as baby friendly. So we're really proud of that initiative, and it's been a 2-year process, and we are now in the sustainability phase. So the Baby Friendly Hospital Initiative helps us make our progress on our third priority, which is increasing access to care and quality of care. It's part of our ongoing effort to reduce obesity in Indian country, and we are a national model for breastfeeding. IHS also is encouraging, and this is a really important endeavor, and our tribal obstetrical facilities to achieve baby-friendly designation. Right now we have 2 that are on that pathway. So what is the Baby Friendly Hospital Initiative? It was launched in 1991 by the World Health Organization and the United Nations Children's Fund. It encourages mothers to breastfeed, gives mothers the information and the confidence and the skills necessary to successfully breastfeed or use formula safely. Over 40 years ago, when I delivered my first baby in Indian country, I was one of the very first rooming ins in Lawton Indian Hospital, and I was one of the very first mothers who wanted to go back to breastfeeding. It's not an alien concept in Indian country. Matter of fact, it's very culturally accepted and promoted. But in some areas where it's more rural, of course, it's not looked on as very modern. Back then it wasn't. So it was a challenge, and I had to confront a lot of the staff to let me have access to my baby. And rooming in right then wasn't a priority. It is for us now. And then facilities are required to implement the 10 steps to successful breastfeeding. The program also gives special recognition and designation to hospitals that have completed its rigorous and comprehensive processes, and it really is it's not an easy pathway. It's not something that's quickly done. It takes a lot of cooperation and collaboration with all of the providers, down to even the type of staff that provide our linen services and our sanitation services and deliver our food to our patients. Everyone has to be part of the training process. So breastfeeding is a department priority. We encourage breastfeeding in several different key IHS initiatives. For example, our IHS Special Diabetes Program for Indians encourages breastfeeding as a way to reduce obesity and help prevent diabetes. Breastfeeding also helps support our Healthy Weight for Life initiative that unifies all of our efforts to promote healthy weight among American Indian and Alaska Natives. It also increases the proportion of infants who are breastfed as a goal of the Healthy People 2020 initiative, and encouraging breastfeeding as a component of Let's Move in Indian Country, which is one of the First Ladies' initiatives. So what are the benefits for the mothers and the children? Breastfeeding has proven to reduce diabetes in both mothers and children. Recent studies have shown that Gila River Indian community members who had been breastfed for at least 2 months or longer experienced a 40% reduction in diabetes prevalence when they were 35 to 39 years of age. Native Canadians who were breastfed in the first year of life significantly reduced their risk of diabetes by age 18. And for every year that women breastfed, they reduced their risk of developing diabetes by 15%. The Centers for Diabetes Control and Prevention estimate that for every month a child is breastfed, his or her risk for childhood obesity decreases by 4%, reaching a plateau at 8 months for a risk reduction of approximately 1/3. So I told you we're now at the sustaining designation part. It's a difficult stage we're in right now, but the benefits of baby-friendly designation takes place at various levels. Programs are focusing right now on the benefits of that designation process, supporting providers' training, collecting and evaluating data to support the effort, and participating in quality improvement activities and collaborating and sharing their best practices. We have a lot of meetings, and we have a very defined sustainability plan that we go over with all of our facilities. So the benefits, again, of the Baby Friendly initiative is to provider buy-in was critical. It's made the Baby Friendly breastfeeding initiative process much easier. our providers' acceptance of this initiative wasn't overnight. It took a little bit of time, even though you'd think that maybe our pediatricians would jump right on board with this, and our nurse midwives were really behind it, but it took a little bit of convincing them that, yes, we can do this in Indian country. Yes, we can make an impact, and we can provide the training necessary to get this done. We now have a lot of our providers who are lactation consultants certified, and the Division of Nursing is promoting that certification training at various, by providing training scholarships to our nurses and to our providers to get that training. We have a hospital culture now that includes new processes and methods to provide maternity care services to support the breastfeeding initiative. For example, all our families stay together in the room, mom, dad, baby, and other children who are part of the family. It's their time to bond. It's their time to grow and get that beginning start in life and make sure that it's safe. We provide rooming in. It's an opportunity for that family again to bond, and it helps the extended family to feel welcomed and to feel comfortable with the new addition to the family. We also foster alternative ways to soothe fussy babies instead of overfeeding them. So we're not giving them the passy, we're not giving them supplemental feedings. We're encouraging touch and rocking and holding the baby, swaddling. Breastfeeding support also follows up in newborn clinics and helps keep the circle of care in balance. Lactation training is another initiative that's part of this whole process. Like I mentioned, we do have now more lactation consultants who are certified, including pediatricians, nurses, and our certified nurse midwives. We have a very robust nurse midwifery model in the Southwest. I'm very proud of that. They've been instrumental in delivering most of our babies in the Midwest for over 25 years. And they are really on board with the breastfeeding and with more of a natural delivery process and helping the moms and teaching the families how critical this is for the baby's health. Medical staff members are not from traditional breastfeeding support areas, and they're seeking more certification and training. And there's also an increased awareness of breastfeeding challenges and knowledge deficits among staff and among family. Providers and staff now seek out evidence-based information. They just don't rely on the old stories. They want to find out, well, what is this based on? So we're pleased with that. We have a lot of our staff are asking a lot of questions. Staff education is critical. We have more than 600 healthcare facilities. The IHS has a large number of clinical staff who directly works with patients, and they keep track of which staff members have current lactation support training. It's really a challenge, and that's part of the requirements for our baby-friendly designation. So we have to keep good records, and then maintaining a robust and qualified workforce to support this initiative is difficult in these trying times right now, especially when the nurse vacancy rates are very high and it's very difficult to retain and recruit staff. Online, we offer baby-friendly training 24/7. This includes 3 hours of mandatory training for providers, and then we require 15 hours of training for nursing staff. And then public health nurses have an additional requirement of additional training. There's also a 2-hour annual baby-friendly update, that a training that they have to maintain as well. And then charting and documenting patient encounters is critical so that information is consistent in our charts, so that parents, we have to ask questions to the parents. Have you fed the baby? Is the baby being fed formula? If so, how much? And chart it. And we need to explain the who, when, why, and how was it done. So when we look at our data and our evaluations, many tribal members get most of their health care at IHS facilities. I'm a consumer. I'm not only a provider, I'm a consumer of our care. So our data collection efforts extend throughout the life cycle, and they often begin prenatally. The lifelong data streams are unique to American Indian and Alaska Native communities. Currently, there are no other data streams outside of IHS that include all of this information. And it's not necessarily easy to get our information either. We've been struggling with that. But our future tribal healthcare evaluators and researchers and planners will have reliable information to use to plan and predict, as well as to look back retrospectively on where we've been and where we're headed. So this is just a snapshot of kind of what our electronic health record looks like, tracking breastfeeding at each clinic.
Next slide.
Oh, sorry. Okay, that's a snapshot. At each one of our clinics, children who are less than 5 years of old, feeding choice, we have to click on that, check that box, and then the feeding choice data then can be searched in our computerized health system and compared for trends by the standardized GPRA format. We also look at standardized documentation practice that support baby-friendly designation. Our GPRA, this is a snapshot of our GPRA results. The IHS GPRA table reflects the percentage of 2-month-old babies who exclusively or mostly breastfed. From the feeding choices clicked at the clinic visits, the percentages of exclusive and mostly breastfeeding for specific age groups can be determined. The electronic system searches for feeding choices, date of visit, the birth date, and that reveals to us reported trends. And then the IHS GPRA goal has been 29%. You can see from this graph, though, that we have exceeded our goal by more than 6%. The table also shows an increase in exclusive and mostly breastfeeding of about 7% from when Baby Friendly began, which was about 2 years ago. So our quality improvement initiatives for Baby Friendly Hospital Initiative includes chart audits and interviews, proof of formula purchase, staff education rosters, and patient education at prenatal and postpartum visits. The Indian Health Service data collection is on both the mother and the baby chart. We do chart reviews to assess for compliance in areas such as supplementation of other formula and skin-to-skin practices. All deliveries are reviewed for data collection, and data are entered into a secure national data port. Employee evaluations now include how well the employee is adhering to the Baby Friendly Hospital Initiative standards, and even our performance appraisals. It's drilled down to Baby Friendly Hospital Initiatives included in there about breastfeeding. We want to make sure everyone gets their training and everyone understands what our priority is, that we are really concerned about mother and baby. Supporting breastfeeding is moving. It's more of a natural process now. It's routine and it's very reliable. So our quality improvement group, this is a snapshot of a couple of our staff. In the middle is one of our gentlemen from the improvement program care team, and then that's his teammate next to him, and then Tina Tall over to the left is our public health nurse consultant. And this team helps support the Baby Friendly Hospital Initiative. It's coordinated through headquarters to support all of the teams out in the field, and all designated facilities must comply with the current Baby Friendly USA guidelines and evaluation criteria. And these people are instrumental in helping host our websites and hosting our webinars and promoting the ongoing education. There's an online toolkit for this phase was made available to hospitals the first week in March. And a six-week weekly webinar series was set up in May. We just finished it with the support of the IPC team and the Baby Friendly Hospital Leads. In July, the Baby Friendly Hospital Leads will submit a monthly audit. This will be one of their first ones with a brief narrative of their activity, and a final report is due to Baby Friendly USA in October 15 of 2015. So our improvement program care team, we call them IPC, they have office hours that offer our 13 Baby Friendly Hospital Leads access to support their quality improvement activities for evaluation and help them with their annual improvement projects. And that's for all of our facilities so that we can maintain and hopefully be redesignated. So sharing and collaboration is a big concern. We have weekly webinars that I talked about earlier. And it's a time for all of our 13 Baby Friendly Hospital Leads and their teams at their hospitals to share their best practices and in order to sustain Baby Friendly designation. They talk about their challenges. They talk about their continuing efforts to practice what they teach and those 10 steps to successfully complete breastfeeding. And the IPC staff are encourage the programs to present how they've addressed the challenge and resolved issues. And we've had some really lively discussions and found out a lot that we weren't really familiar with in the past. So in sharing best practices, our baby-friendly hospital leads share their audit results and their PDSA activities to target the quality improvement activities that they have defined. And our baby-friendly hospital leads also strive to meet the goal of achieving step 3 at 80%, which is to inform all our pregnant women about the benefits and management of breastfeeding. So staff practice. Most of our employees are returning to work and continue to breastfeed. I was one of them 40 years ago, and I breastfed all 3 of my kids. And even though we didn't have a policy in place back then at our Indian Health facilities, I was very supported by our senior leadership. They provided me with breast pumps, and now we have a policy that supports all that. I'm really pleased with that. We have worksite breastfeeding pumps. No longer are you stuck in a closet and are in an uncomfortable area. They have designated areas with comfortable seating, adequate lighting, water, a clock, tissues, all of the supplies that you need to be comfortable and for your baby to be comfortable if you have your baby with you, or to pump and to store your supplies and store your milk. More and more of our employees are talking now about feeling comfortable about returning to work, maybe a little bit early, and breastfeeding. They're comfortable about the local resources, and they understand how the facility works, and that the facility and their supervisors are supporting their efforts as being a new mom and wanting to give their baby the best opportunities and the best nutrition possible. So this is just a quick snapshot of one facility. It's Phoenix Indian Medical Center and their breastfeeding room, which was inside of their pediatric clinic. Not a very good shot, but it just shows you a little bit about the breastfeeding pump that we have in there. We have a sign that they hang on the door that says Mom at Work, and all staff know to leave the mother alone when she's in there. We have typically 2 chairs in each room, so we have more than one mom who may be pumping, that she can have privacy, and they have a screen. It's a very comfortable room, and they can play their music and take their time, and there's no rush. So what are our future efforts? Texting is being piloted at several of our facilities. These are simple, really personal messages that go out to new families and who are discharged from the hospital or who've been in for a pediatric visit. We teach and provide online lactation education. It's available in some areas, and so staff can train without leaving work when they're at home. Some are using the training opportunities to begin their path to get that international board certified lactation consultant certificate, which is really critical, and we have several of those who've accomplished that. We also continue to collaborate with our public health nurses and our community health representatives in the field and our local outreach programs in the community to better support breastfeeding in the community and moms and babies. That's the end. This last picture is, unfortunately you can't see it, that poster, if you haven't seen the Baby Friendly USA poster, it's a mom and a baby who is nursing, and this is at one of our facilities who just recently designated, and that is Dr. Susan Carroll, who's our Chief Medical Officer of Indian Health Service, presenting it to the staff there at Chin Lee Medical Center on the left. And then down here, my hair was longer, this is another team where we provided them with their poster. And typically we have a huge celebration, and the whole facility and the tribes come out. They're all excited that we've accomplished this goal, and they're all excited that we're pushing and promoting breastfeeding and helping mothers who don't want to breastfeed to choose and provide formula safely. Thank you. Do you have any questions? Yes.
Please come to the microphone. Please introduce yourself and ask your question. I'm going to limit us to one question because I know everybody's got planes to catch and all sorts of
Thank
things.
you.
So we're going to.
Okay, good afternoon. My name is Mike Arts. I work with UNICEF here in New York. So I want to congratulate you with
Thank
your achievement. It's very exciting. I know many of you are working on Baby Friendly, and I think it's exciting to see you so excited about it and the results that you've achieved. I'm interested to know more about the sustainability aspect. You mentioned some of it, but you also alluded to a more comprehensive program. I'm not sure that you're able to explain it all now, but we can
I'll just briefly, because I know you want to move forward. We have a grid that we provide all of our baby-friendly leads. The group divides that grid based on what baby-friendly requires on reporting, because it can be a little complicated to figure all that out. So we have a grid and we check it off, and we make sure during those webinars we go over it. We review their data and their audits during those webinars to make sure that they're reporting and collecting the things, if there's any issues that might be a problem, and make sure that they are getting their additional training and keeping up that training. But they're happy to share with you the grid if you'd like to see it. It wasn't anything that Baby Friendly supplied to us. And of course, you know, if you're on that Baby Friendly journey, you've got to have a team and an approach, and it just can't be something you just decide to launch. You've got to have a really designated plan. Indian Health Service would be happy to share with you our sustainability plan, and it's working well.
I think that's we were designated baby friendly in 2000, and it's, it is, you have to figure out how you're going to sustain it, how you're going to track it, how you're going to keep it from rolling back down the hill.
Exactly. Thank you very much.
Thank you.